At this point, I'd like to move to our featured speaker. It's Kim Kaur from representing Chatham-Kent Health Alliance. We'll make sure that Kim is ready to go. All right, I think we got the slides ready to go there. Welcome, Kim.
Hi, can you hear me?
I can. And we're excited to have Kim. Like I said, she works with Transform Shared Service Organization. They work with Chatham-Kent Health Alliance, and she has been a FormFast user for a good number of years. I think we came up with 14 years. Is that correct?
I think it's 13, but close.
Close enough. So we invited Kim to come and share some of her experience with FormFast and how their organization is using our solutions. So Kim, I'll let you take it from here.
Okay. Good afternoon, everyone. I'm Kimberly Kaur from Transform Shared Service Organization in Ontario, Canada. My office is in Chatham, which for your frame of reference geographically is about an hour's drive northeast from Windsor, Ontario, Detroit, Michigan border, if you know where that is. And we're about 3 hours away from Toronto. Am I the only Canadian on the group? Maybe. I've been in my role for about 14 years as a support analyst with lots of different hats. I'm a report writer for many different applications using multiple tools for multiple hospitals, as well as a FormFast person for the Chatham-Kent Health Alliance. Some of the stuff I do is SQL, Star Vista reporting in QRE, Crystal reports for apps like Pathways Healthcare Scheduling, PHS, as some of you will know by, Horizon Surgical Manager, HSM, PowerScribe, and business objects for Horizon Clinicals, Care Records, things like that. Basically, I'm a coding geek that's emotionally committed to data quality. But one of my favorite roles is FormFast. So I'm just going to quickly tell you a little about Transform and about CKHA, and then I'll share some of the things we've done that I thought were a little out of the box and hope you're interested in.
And Kim, I'm going to jump in. I got some reports from the chat that it's a little soft on their end. So might make sure the phone is turned up.
Is that any better?
Better? Didn't change on my end.
I'll just try and talk louder.
Oh, there we go. That's perfect.
Is that better?
Yep.
Like
Thank you very much.
Off the headset, if you'd rather.
And I'll send you feedback from the audience via chat as you go through.
Okay.
Sorry for the interruption.
That's okay. So Transform Shared Service Organization, we started with just 2 organizations coming together to share resources and save money, and it's really grown from there. Now Transform's a unique, innovative, results-driven organization that offers a lot of different integrated services and back office support, mostly in information technology, information management, supply chain, and project management. And we're owned by the 5 hospitals in the Erie St. Clair LHIN. I imagine a lot of you don't know what a LHIN is. It's LHIN. It stands for a Local Health Integration Network. And those are the health authorities responsible for regional administration of public health care services in the province of Ontario. Transform is governed by a board of directors comprised of senior executives from all 5 of the hospitals that you can see on the slide. And I've highlighted the Chatham-Kent Health Alliance as they're the ones using FormFast as their form solution. And I'll be highlighting some of that in the presentation. Can you hear me better now? Are we good?
They're saying it's still a little bit soft.
Okay, hang on. I'm going to switch off of the headset. Is that better?
Yeah, that's much better. Thank you.
Okay. Okay, we currently have 4 strategic directions and goals. The first one is service, providing exceptional service through service agreements, service level agreements, setting target expectations and indicators, and customer service frameworks. The next is performance, providing maximum value to our customers through measurement strategies, continuous improvement methodologies, savings, and efficiencies. Then innovation, leading change management framework philosophies, investigating and initiating new innovations to improve health systems, and leading a culture of innovation strategies. And for our people, providing support to staff through human resources, recruitment, retention, succession planning, leadership development, educational, professional development, so employees can really strive for personal excellence. So the Chatham-Kent Health Alliance is a partnership of 3 hospital corporations at 2 campuses located in Chatham and Wallaceburg. It's a 200+ plus bed community hospital system with state-of-the-art facilities and technologies, with 1,350 staff, 280 healthcare professionals, and 500 volunteers. Our clinical programs are emergency services, mental health and addictions, rehab and continuing complex care, surgery and ambulatory care, and women and children's health, with annual statistics of about 10,000 inpatient visits and 65,000 ER visits annually. Some of CKHA's achievements: they're a best practice spotlight organization, national leader for clinical technology, recipient of several provincial awards for employment excellence, information technology, communications, and environmental efforts, state-of-the-art facilities and technologies, like I mentioned before, with an average patient satisfaction of over 92%. We're linked to tertiary centers in London, Windsor, and beyond. Academically affiliated with the Schulich School of Medicine at the University of Western Ontario. So this is a technology profile. I'm just going to kind of blow through this and not read it. It'll just be a takeaway as a comparison for you later if you wanted our hospital to yours comparison. So let's move on to our use of FormFast. We've been using FormFast for 13 years this month, so since June of 2001. We're using FormFast Designer, Job Manager, and Print Manager. And we have FormFast on 2 virtual servers, one for registration and diagnostic imaging, and the other one for finance. What we were finding is over time that some of the larger finance jobs were holding up the queue, so we split the job sets into 2 virtual servers, and then that Monday morning and month-end batch stuff finance was running stopped affecting registration and DI. The data streams we're using come from our HRIS, ADT triggers, and from our clinical app when an order is placed. And we print to 3 printer types: label, laser, and dot matrix. So our reasons for using FormFast, the big one was the right information in the right place at the right time. And there's lots of great reasons for using FormFast, but that was our biggest reason, because a big part of the CKHA philosophy was to enter data once and use it many times. And FormFast really helps us achieve that. So from our implementation, if we had it to do over again, I think the first thing we do is implement more forms. The volume of forms that we're doing through FormFast now is lower than it could be. We had this informal plan of doing more later, and then it just never happened, and the resources to go looking for the extra work just don't exist. The FormFast support role isn't full-time, so there's no time to go after the new projects, especially if those of you out there like me are wearing many hats with competing priorities. So, I mean, we think it would have been better if we'd had a formal plan to implement more forms and phase it in with specific goals for specific forms and set targets and dates for timelines. So then the question of how did we overcome any challenges to adoption? We really didn't. Honestly, the staff was so thrilled at not having to remember which forms to print when, and our go live was a big win for them. Some of the registration areas are smaller, so they're happy not to have their prime real estate taken up with multiple different blank pre-printed forms that they had to use and then fill out. I can still remember the calls I got way back then. Like, staff just could not wait for us to implement FormFast. We were flooded with, can you do this? Can you do that? They were just really excited. We had no pushback at all. So what the CKHA staff really loves is that the forms are written and designed the way the user wants to apply them. It's flexible, and they can design what they want to work for them. That was a finance accounts receivable clerk. Not wasting time digging through papers, then writing everything on them. It was safer for the patients with everything electronic. The diagnostic imaging likes that they get an immediate notification of an order from the floor so that they can then reconcile it with the requisition that they receive from the doctor. Current use. What best practices have we implemented? An important one for us was process reviews. When a request comes along for a new form, we look at the whole process and ask, is this the only form? Is it the best practice? Does it actually need printing? Sort of like a mini lean process, cutting out wasted steps. So one of the things we did way back was we got all the areas together to figure out how many labels they needed for different patient groupings and functions, and then compiled a list of those common label numbers that they needed, and we built those options in a user-defined field in STAR, which is our HIS. The labels were especially fond of how we did this because it allowed users to choose the right number of labels for whatever registration type it was. So for example, if they just needed a few more labels, they could just kind of pick a couple of more, and they didn't have to wait a whole sheet that then had to go in the shredder just because they needed 2 labels. They can just print what they need. Even if it's just an armband, they've got lots of choices. It's easy. It's just a click and pick from the front end for the user during registration or later if they need more. It's less waste, less shredding costs. And there's also the reduced risk of labels ending up in the wrong hands with the extras. So some of the most heard FormFast adjectives. CKHA thinks FormFast is fantastic in the way it keeps their forms management organized. Forms are always ready, and the right form at the right time to the right place is printed by what the users call that magic in the background. It's been fun finding ways to do things outside the box, and the awesome staff at FormFast have helped us achieve that, making the process seamless for our end users. The bottom line is that FormFast is trusted to deliver what they need when they need it. So future use. For us, a big thing is an upgrade. We're long overdue, and my advice would be to find someone at your hospital via champion and request upgrades. When no area owns it, it's hard to get an upgrade on a project plan because it's not on anyone's radar. Everyone agrees it needs to happen, but nobody formally requests it. They just kind of wait for a resource like myself to make it so. So it would really help to find a champion to help keeping up be a priority. And the next thing is, now that we know we can print order sets from an order message, there's potential for this to be more widespread than it currently is. So I'm going to move on to a little bit what we did for our 3-part forms. I wanted to show you that we're able to send data to a dot matrix printer by tricking FormFast into thinking we were sending PCL code to a thermal printer. So in the job, we set the print model in the settings to thermal and just sent plain text. So coordinating the data stream changes can be a challenge in a busy organization. So we tried to think ahead, knowing it was easier to make changes on the FormFast side than it was on the data stream, because I don't know about for other hospitals, but certainly on the STAR side, when you need a forms and menus person, if they're really busy, you sometimes have to wait. So we were trying to think what we could do that would make it so we could make the changes on FormFast without that delay. It was a little tricky at first, lining everything up, a bit fiddly with padding the pieces of data into a row, but it was totally worth it in the end. We were able to use an existing data stream and map only what we needed. We wanted to add data elements and just have them print only in certain areas. So you see that infection control alert in the comments? We only wanted that to print in some areas and not others. So instead of having 2 data streams, we did it in one, and then in that particular line, we just left it out for the other areas. That's not true anymore. I think everybody gets it now. But originally, they only wanted it in the ER. So that row where you see the account number, admit date, patient type, the whole row is a single string of data with padded elements and strung together in one string representing a single print line of data. And then the whole process was repeated for the 12 or 13 rows that are there. Like I said, it took a little bit of fiddling with the padding and figuring out the font and the pitch and everything on the printer, but it was totally worth it. So our order sets. The next thing we did that was a little different was to use a non-ADT HL7 message to trigger a form print. So we didn't do this through the patient tracker at all. We just took the HL7 message the way it was. So this screenshot is of the job that prints the C. diff order set in the ER whenever an order is placed on the C. diff culture for an ER patient. Once we figured out our file locking issues with the individual message, it was all good. The only time we ever really had an issue was when the counter in the OBR segment increased from 8 to 9 characters, but that was a really simple fix. And anyone who does FormFast regularly knows how easy it is to change those things. So in the merge fields, we just pieced out the data we wanted. And if you can see how the message looks on the left there, you could choose the row of data and then the elements, figure out where the elements were and just kind of build from there. So you can see in the merge field properties, we just chose the row the data element displayed on, and you saw that on the previous slide on the left there. And in this case, we made the width 10,000 characters. So we just pieced it out of the HL7 message and then put that many after operators with that pipe delimiter and argument for each piece. And then you can kind of see on the right-hand side of the screen where it says that before and the date of birth thing. So that did it as a prefix once you got to that area. That part was actually really easy, especially if you're comfortable with HL7 messages. And if you're not, anyone at your organization who knows HL7 would be able to help you with where the elements were. So going back to those custom user-defined fields, instead of creating multiple data streams like I talked about, we just used that user-defined field with values we could modify on our end if anything changed. The way it is now, we just dropped that single user-defined field onto the data stream, so any new values just flowed there and there was no extra work for us to do. We just changed the criteria on FormFast to allow it to print. And that's just a screenshot of where they would choose that. And that list would have been better with an ASCII sort in mind so that things sorted nicer. I wasn't involved in that part of the creation. But the staff are pretty happy with the choices they have, and there's an opportunity for less waste. So the value they choose from this drop-down appears in the data stream. So this is just a quick screenshot of what one of our sheets of labels look like. The sheets of labels with armband print 6 armband labels, 2 PEDs, the ones at the very top left, which fold nicely in half over the little cardboard strip. You know that little strip that goes in the armband? And then there's 4 adult labels. And the rest of the labels are all the same except for the one in the bottom right, and it was just a little different. Health records just wanted one label that had the physician's, their family physician name on it with their phone number. So we did that for them. The rest of the labels are all the same. And the single label options that you saw in the drop-down, all the labels are built exactly the same. So whether they come from the little thermal printers or whether they come from one of these sheets of labels, they're consistent across the board. So no matter where they got it, you can't tell once it's on a document where the label came from. They're that exact. So the big news, though, was that these labels completely replaced those embossed cards. So they didn't have to have those printers anymore. The staff didn't need to run forms across them like those old Visa things. And it was a big win for the staff not to have to do that, and it was a big budget win as well. So just in summary, FormFast allows CKHA to work smarter, not harder, by perpetuating the philosophy of enter once, use many times to reduce errors, reduce waste, save time and money, and eliminate some of the patient safety risks. The flexibility to do what we want, the way we want to do it. It's not always, in ways just, not only were we not sure we could do it, but neither was FormFast at first. And that's the beauty of working with FormFast, because even when we had all these crazy ideas and questions about using their products in a way they weren't being used yet, the technical folks were right in there saying with us, yeah, let's see if we can do that, instead of telling us, no one's doing that or you can't, and we did it. The forms that still print, the labels replacing the use of the embossed cards was huge, and we've even found that staff have creatively used those labels where previously they were writing patient information on paper we didn't even know about. So that's my time. I'd like to thank you for your time and thank FormFast for the opportunity to talk to you. And if you had any questions about how we did any of this or anything else, really, I've been doing this a long time, and I'm always happy to help, so feel free to get in touch with me anytime.
Thanks, Kim. Great presentation. Really like those FormFast adjectives. That might be something that we use in the our own marketing. Yeah, it didn't put you up to that, but yeah, we like that. We like that. And one of the questions we had in the chat is how can we connect with you in order to ask more questions? So it sounds like there is some interest in sharing some information offline. So remind people how they can reach out to you.
Well, my contact information is right up here on the screen. My email is kimberly.core@transformsso.ca, and the phone number is 519-352-6401, extension 6971. And I'm usually at my desk 8:30 to 4 Eastern Standard Time. But, you know, shoot me an email anytime or just call me directly. I have no problem with questions.
Great.
You know, there's no sense in reinventing the wheel. If we've done something you need, I'm happy to share it.